Welcome to Afaxys Candid Conversations in Public Health, a new podcast series from Afaxys, a public benefit corporation serving public health clinicians and their patients. Join us as we head to the front lines of sexual and reproductive health care, bringing you timely discussions with leading experts who are shaping the future of public health.
Good morning and welcome to Candid Conversations in Public Health, an Afaxys-sponsored monthly podcast program developed to bring together leading experts in the field of sexual and reproductive health to discuss relevant topics of importance to the public health community. Our topic for today, which is the second in our series of 10 podcasts, is on the front lines of sexual and reproductive health, accessing continuing clinical contraceptive education and resources. I'm Beth Atias, and I'm delighted to be moderating today's conversation. And I'm joined also by Dr. Kristen Feldman, Vice President of Medical Affairs at Afaxys. Our expert guest for today is Dr. Jen Karlin, an Associate Professor at the University of California, San Francisco, Department of Family and Community Medicine, and Project Principal Investigator, Reproductive Health Hotline, also known as the Repro-HH, Associate Professor, University of California, San Francisco, Family and Community Medicine. Dr. Karlin, thank you so much for joining us today. I understand that not only do you have a marathon of very impressive titles, but you also just recently completed a marathon of a 17-mile swim, which is utterly amazing. If you'd like to comment on that incredible feat.
Wow. Yeah. It was an incredible experience. I swam from Catalina Island, which is off the coast of California, to the coast of California, which actually completed 22 miles. It was the longest swim I'd ever done. And previous to it, I had only swam 8 hours consistently in the water for this swim because the swells were so strong and difficult. What should have taken me 12 hours actually took 17 hours. So it really was an epic swim, and it required me to bring in the support and energy from so many other people and such a great team to support me. There's no way I ever could have done that individually without all of that help. And I know today that's something we're going to be talking about, is all the help that we have in our community to help us care for patients well. So it was making me think about that my whole swim.
Wow, that's quite moving and powerful. So congratulations. I mean,
Thank you.
we know that you have passion and purpose in all aspects of your life, and we're looking forward to bringing that to our listeners today.
Aw.
Could we begin with you sharing your background in your own words, your journey and your role within the public health, sexual and reproductive health arena? And if you also could provide any relevant disclosures before we begin our discussion, please.
Yeah, I think you caught most of my affiliations. There is a long list of them, and I'm very grateful to have many teams of people that I work with in the research arena and in the clinical care and education arenas. But in addition to those that you mentioned, I should say that I do work per diem for Planned Parenthood NorCal, and I have consulted for Afaxys in the past. But any of the opinions that I share today are those of my own and not the institutions that I'm affiliated with. I also don't have any relevant financial disclosures to share today.
Great. Thank you. Thanks so much. And Dr. Kristen Feldman, would you like also to introduce yourself and perhaps share a little bit about Afaxys for our listeners who might not be familiar with the work that you do there?
Sure. Thank you, Beth. Afaxys is a public benefit corporation, and we serve the needs of public health clinicians and their patients. We have a drug development arm, a pharmaceutical arm with a portfolio of generic and oral emergency contraceptives, and a group purchasing organization that provides small public health clinics with access to favorable pricing for tons of products and services that they use every day in their clinics.
Great, thank you. As I mentioned earlier, we'd like to talk today about clinician continuing education and sexual and reproductive health resources for clinicians who are not necessarily sexual and reproductive health specialists with the type of extensive experience that Dr. Karlin that you have. We do know that clinicians have both a desire and a responsibility to educate themselves as well as their patients specific to sexual and reproductive health topics, especially as medical knowledge evolves over time. So, Dr. Karlin, you bring such a unique perspective as to how clinicians can continue their education for several reasons. You have such an interesting background in medical anthropology and clinical ethics. You're a family doctor who's specially trained with a fellowship in complex family planning, a medical student and resident instructor, an associate editor for the Annals of Family Medicine, as you mentioned, medical advisor to FAMPAC. So could you share with our listeners how these interesting and impressive experiences have shaped your views on medical education, and maybe especially for those clinicians for whom it is important and desirous to really continue to be lifelong learners?
Yeah. So I've been teaching for over 20 years now, since I started my graduate work in 2004. And I've been teaching to a variety of students, from undergraduates to medical and graduate school students, as well as actively working clinicians like physician assistants and nurse practitioners and residents and fellows and other attendings who are my colleagues. Also, in the capacity of being the supervisor for Family Pact, I oversee trainings for the state of California on topics related to sexual and reproductive health. And so I travel across the state to provide IUD trainings and pain management trainings, for example. And so what I've learned in all of these roles is that adult lifelong learners really acquire new skills and information in the moment when they have a direct question or a patient in front of them that they're trying to figure it out. So we really can prepare our adult learners with the backgrounds they need, but in the moment, they want to be able to figure out the answer and support the question that they may not know. And so these ready-made resources that they can trust are really, really essential. One of the other things I guess I've noticed as an associate editor of Annals of Family Medicine, where I'm really reviewing a lot of the new research that's coming out, is that I know that there are family doctors who really struggle with keeping up with all of the information that they need to know. And so to keep up with that new data and evidence is challenging. And so it really needs to also be synthesized in a way where the new studies and the new knowledge that's coming out can be incorporated in a practical way for people to use in their own clinic settings.
Great. That's really fantastic. Almost like on demand, but also I think all of us feel that we have so much information coming at us, all the
Right.
time. And so really synthesizing and distilling it, for practical application is I'm sure so very helpful. So thank you. Dr. Feldman, you've been practicing for quite some time. You're still a clinician in addition to your role in medical affairs within Afaxys, which is so fabulous. But from your perspective, what changes have you seen in contraception knowledge and education, maybe since you first entered your clinical practice?
Well, it has changed a lot, Beth. I've been practicing more than 20 years at this point in time, and we have so much more knowledge about contraception and different options than we did previously. So just as one example, when I first started practicing, we were quite restrictive in placing intrauterine devices or IUDs. For example, we did not place IUDs in women who had not had children or in those who had had previous pelvic infections. And then through more studies over time, we actually learned that it was safe to use IUDs in these situations. And just additionally, we have so many more methods now than what we had 25 years ago. Just off the top of my head, 2 more IUDs and one that was approved by the FDA this year. So it can be hard to keep up at times. And typically I've used the CDC's medical eligibility criteria, or the MEC. and also the CDC's selected practice recommendations, or the SPR, to stay current in my clinic. And these were typically updated about every 5 to 6 years or so, up until COVID, and then it was delayed, but most recently updated in 2024. That said, based on some of the changes over the summer at CDC, it's not really clear whether CDC will continue to support updates to these resources. So in my mind, Jen, that begs the question, what other resources are out there and available to clinicians who want to stay up to date in contraceptive care?
Yeah, thank you, Kristen. The examples that you provided are so great. And thank you for mentioning the SPR and the MEC. Those two resources are really incredible because the MEC, which you explained and talked about, it's a table that cross-references contraceptive methods and medical conditions. And it provides guidance about which are safe in which circumstances for patients. And the thing that's always been incredible to me about that document is that it synthesizes and distills so much information in one image. And that kind of reference is so important for clinicians who are seeing patients, many of whom are seeing patients every 15 to 20 minutes.
Yeah.
And so you can get so much information that is easily digestible just by glancing at that chart. And then, of course, it was referenced. So if you wanted to do a deep dive into the literature, you absolutely can get the reasoning behind those recommendations. So in that way, it's really an ideal reference for clinicians. And as you mentioned, we don't know if it's going to keep being updated. And so there are other organizations who have really stepped up to try to develop materials that are well designed, whether those are just provider facing or provider facing and patient facing. And so I want to tell you all about some of those. So one of them is Bedsider Provider Plus. Really excellent resource. They reference other content and make sure that it's of quality. And then they also produce their own content. There's also the Clinician Training Center for Sexual and Reproductive Health. That organization really focuses on our Title X clinics, but they develop toolkits and work tools to be able to integrate new procedures and new workflows into clinics where they may have not been before. And so that website has a wealth of information.
Yeah, we actually had some folks from the CTC-SRH on our last podcast.
Yes.
And they have some really great, algorithms and job aids that, anyone can use. The site is designed for Title X providers, but anybody can access the toolkits. And I found them to be very helpful.
Yes, they are wonderful. I've actually collaborated with them on some of their toolkits also. It is really a great resource. There's also the Reproductive Health Access Project. That organization is wonderful because their patient-facing materials are also excellent. They have them in many, many languages. And so not only do they give providers tools, but they give ready-made resources, which we know providers are always asking for to be able to provide to their patients. Of course, there are some other organizations that require some logins. So those include ACOG. ACOG has clinical guidance and guidelines, but you do need to pay for the organization and to log in. Also, UpToDate, of course, has up-to-date clinical information, but again, you need a login. The Society for Family Planning does have a clinical guidelines library, which is accessible to everyone. And one other great resource that has videos on how to do some procedures is Innovating Education and Reproductive Health. So that's a project at the Bixby Center for Global Reproductive Health. And those videos are longer, so they aren't a ready on-demand resource. But if somebody wants to do a deeper dive into watching a 15-minute video, they have really excellent clinical information that is geared for practitioners.
Okay, so I did not know about that. So you're educating me today. Can you say the name of it again?
Sure. Innovating Education and Reproductive Health.
Okay, awesome.
And
I'll bookmark that.
Yeah, I was just going to say for our listeners who are absorbing all of this great information. We will have it in the show notes with links to access. So if you're not catching all of this live, rest assured, we'll have it for you in the show notes. We're learning here real time along with our listeners, which is always fantastic. So sometimes we do know, however, that, maybe resources, just, aren't enough for providers. And Dr. Karlin, could you maybe share some perspectives around how our listeners, and other providers could learn new skills, within the sexual and reproductive health arena, like placing IUDs and null-ups and procedures such as that?
That's a great question, Beth. Thank you so much for bringing that up, because Kristen had brought up this notion that we used to not think about placing IUDs in people who hadn't had childbirth previously. And there also has been new guidance about offering pain management and paracervical block. But what we know from a lot of data of studying physicians is that physicians and providers are sometimes very nervous about trying new procedures. I'm a historian of medicine and anthropologist, and, our practice, the medical field, has always been based on apprenticeship. And so even if providers have watched a procedure and learned how to do it, maybe they've watched the videos that we've talked about, they've read about it, they feel very comfortable. When they see that first patient by themselves, even if someone's been in the room with them before watching, they're a little bit nervous to do it. And so what we know is that when getting trained with a new skill, clinicians really want some more direct support, direct peer support. So it isn't just about the information, but it's also about that peer support, right? And that collegiality that makes people feel like they can try something new and do something that they very well know they are capable of doing. And it really is the responsibility of the care provider to be able to offer that knowledge and support to their patients at their point of access, rather than sending them to a specialist, which increases costs for our healthcare system, but also is really inconvenient for our patients to see somebody new that they haven't met before, that's in a new location. And in some instances, it also increases criminalization and stigma for people who are trying to access sexual and reproductive health. And so actually, that is why we launched at UCSF a new reproductive health hotline, which you mentioned I'm the principal investigator of, but I work with a large team that has launched a hotline in June that supports healthcare clinicians nationwide, providing on-demand information and clinical support for providers about questions about sexual and reproductive health.
Well, that's really fantastic. I mean, the idea that there's that community of knowledgeable support, for that individual physician is just fantastic. The reproductive health hotline sounds just so interesting, and I'm certain that our listeners would love to learn more about it, how it works and how they could access it, if you could share that.
Absolutely. So currently we're available from 8 to 4 Pacific. We are looking to expand our hours. So if more people from your podcast call us, we will expand more calls to the early morning and cover those early East Coast times.
Fabulous.
Yeah. We are sustainably funded for 5 years. So people who call can know that we will be there for the next 5 years to be able to answer their questions. And we're able to take calls from anywhere nationwide, as long as the person who's calling is not the individual patient themselves or a friend or family member. So anyone who is working in the healthcare field, whether that be a community health worker, whether that be a nurse, a physician assistant, a doula, a midwife, or a physician who's a primary care doctor or an OB-GYN, there is no question that is too silly, and there's no question that is too complex. And we answer questions that have to do broadly with sexual and reproductive health. So we're talking about, times from the teenage years, teenagers who are starting their periods, and the provider doesn't know how to manage really heavy bleeding in menarche. And then we get questions about menopause. So we are able to answer questions across the lifespan. And what that sort of looks like for someone calling in is that you call in. Our phone number is 1-844-REPRO, so REPROHH. And the number, I guess, will be in at the bottom of this to link. You call in and you listen to a message that is about 5 seconds long. And within 15 seconds, you're transferred to a live triage agent. You're asked only 2 questions. One, if you're a licensed healthcare provider, and also that you agree to our terms of service. The terms of service are listed on our website at Repro, reprohh.ucsf.edu. If you are a community health worker, you're directed immediately to a physician. And if you are a licensed healthcare provider, you are asked one more question, which is if you are inside or outside California. Now, we're funded by the state of California. And so they wanted us to ask a few more questions to our California providers so that we could really support workforce development. But outside of California, we do not ask any questions about where anyone is located. And all calls are absolutely anonymous. And so all the phone numbers, we're unable to see where the phone numbers are coming in. And we do not collect any identifying information about the provider or the clinic or the healthcare protected information if they're calling about an individual patient. Although, of course, we're also welcome to general questions that are not about individual patients. Anyone can remain anonymous, even if they're in California. And then once that question is answered, they're transferred immediately to a physician. And it's amazing. I just looked at our data from our telecommunications system, and it's been taking about 30 to 90 seconds from the initial call to speaking to a physician and getting the question answered. At the end, we ask if there are some demographic questions that are, again, non-identifiable that people want to answer. And if they do, then we will take that information down. But otherwise, no information needs to be provided, and they could go straight back to taking care of their patient.
That's
Utterly
so great.
fantastic and great, Kristen. Yes.
Yeah. I mean, it just sounds so useful. I mean, even as an OBGYN, there have been times when it would have been helpful for me to call in. Just as an example, last year I had a patient who had moved to the US from somewhere in South America, I don't remember where, and she had 2 arm implants and wanted those removed. Now, our listeners probably know that in the US, we only have 1 arm implant, not 2. So I thought that she probably had a Jadel implant, but I didn't really know for sure. And I didn't really know whether that type of removal was just the same as an Explanton removal. So I referred her out to a tertiary care center. But I think if I'd had access to this Repro Health Hotline, I probably would not have needed to do that. So, I mean, that's amazing.
Exactly. That is exactly the problem that we're trying to solve. And, it has been really interesting looking back at some of our calls. Like I said, we launched in June, and we've received about 85 calls so far. We would love to help anyone listening to this to call us, but also help us with promotion. Since this is a free confidential service nationwide, we really want broad knowledge about it for anyone to call, from people who are specialists, like you just said, already in the obstetric and gynecology field. But also we get callers who are specialists in cardiology or endocrinology who are asking questions about birth control with certain conditions. So we can answer any of those things. And interestingly, right now, about a quarter of our calls are from inside California. About 3/4 are from outside California. And then about 60% are physicians. And they range from primary care physicians to specialists of different sorts, emergency room doctors, people working in urgent care settings, etc. And then 30% are advanced care providers, which include physician assistants and nurse practitioners And then we've heard from about 5% of nurses and 5% community health workers and pharmacists. And so we're getting the right calls. We're just looking to have more volume so that we can make sure that we're really helping with healthcare access across the country. As we know, right now, we're seeing fewer and fewer people being able to access reproductive and sexual health specialists. And so this really keeps the care located in the place where people want to receive it, which is from their primary care doctors in their local communities that they know and that they go to and that they feel comfortable with. And so thank you for sharing that, Kristen. Yes, next time you have a question, please call.
Now I can, because now I have access to this health hotline. So that's just so great.
I should mention that all of our clinicians who are answering the calls are UCSF, California licensed physicians. They work for UCSF and they have expertise in sexual and reproductive health, whether that's going to a fellowship in family planning or having an extensive career working in this space for over 20 to 30 years. So everyone who we have hired to be answering the calls really has that extensive experience and focuses in this area so that they can provide the specialty knowledge to people who have broader areas of care in their own practice. The other thing I really want to mention and circle back to is this idea again about peer support. And really, it takes a team to take care of people. It takes a team to swim a marathon. It might look like an individual sport, but it really is a team that's behind that. And so when we think about a lot of our solo practitioners who are out there, knowing the best answers for things, oftentimes they know the answer themselves, but they also just want to call to make sure that it aligns with the best evidence that we have at the time. Some people say to me that AI could take over the hotline, but there are complexities to any given contextual situation that a patient is in or an individual is in. And it really requires knowing not just the information, but understanding the context that provider and that provider-patient dynamic is in to be able to provide the best information for the provider at that time. And that's the kind of thing that our clinicians on the Repro Health Hotline are able to provide.
Oh, that's great. Yeah. And so just thinking back to my South American patient, it sounds like the hotline not only benefits the provider and the patient, but also could potentially, at a systems level, kind of decrease the costs of sending patients to a specialist.
Exactly. That was some of the goals why the state of California is supporting this hotline, because
saving money.
Exactly. It saves the system money at the end of the day. You avoid overtreatment. You reduce unnecessary referrals. You support primary care clinicians to practice their full scope, which is what they were trained to do. And then you're improving care and confidence in managing reproductive and sexual health across the board. We actually knew that this model worked. We built this model based on another warm line model that was developed 30 years ago. So the National Clinician Consultation Center, or the NCCC, is often referred to in the clinical community as the HIV warm line. And it's been around for about 30 years, and it was developed during the HIV/AIDS crisis to support clinicians where they were, wherever in the country, because San Francisco was seeing so many patients at that time, right, who had HIV/AIDS. And so they were learning a lot of treatment modalities in the moment, but they were also learning how not to be scared and not fearful of caring for those patients. It's not just the evidence-based information and knowledge from experienced clinicians who have dealt with similar situations that helps the callers, but also that peer-to-peer support. That's so essential for a clinician to feel empowered to care for their patients. Because again, we were all trained in an apprenticeship model. We were all trained with someone that we were watching and modeling ourselves after. And that was, letting us leap from the tree if we were birds, right? And so that's the same kind of thing that we're trying to help providers do so that they feel really empowered in the care that they're giving. And we're able to provide that on demand and in the moment.
That's so fantastic. This information, without question, I'm sure will be so valuable for our listeners. This really surround sound approach that's very integrative and dynamic and on demand. So I know you would love to share this valuable resource. And for our listeners, I mean, golly, the more calls, the more hours. When do you ever hear that these days? The more demand, the more support. I love it. 1-844-REPRO-HH.
And you could go onto our website to find more information, read our terms of service, and also get magnets, stickers, palm cards, anything that will help you remember to call us or help your colleagues remember to call us in the moment. And you can get that at reprohh.ucsf.edu. You can also contact the project manager there, receive the materials. Physically, we will mail them to you, or we can send them to you digitally. You're able to download them from our website. There also is a QR code that you could scan, and it immediately puts our phone number into your contact list for quick dial access. And so please tell everyone about us if you think this would be useful to them. And we are so happy to help as many healthcare clinicians out there as possible.
They're really fantastic. Our time has gone by so quickly. Any final comments before we close out this podcast?
I guess I would just bring this back to how we opened it again, but you're not alone. We all practice as a team, and we're trained to do this work, and there are tools and resources out there to care for your patients and to provide quality evidence-based care.
Great. I'm sure our listeners feel very supported by those comments as well. So lovely. So thank you so much, Drs. Karlin and Feldman. This is a wrap for us today. We will provide the links, as we mentioned, in our show notes. And then please be on the lookout for next month's episode of Candid Conversations in Public Health, where we will be focusing on the new frontiers of HIV and BV prevention and implications for treatment with Drs. Park and Cohen. So that's up on our calendar for next month. But for now, we'll say goodbye and thank you so much.
Thanks for listening to Afaxys Candid Conversations in Public Health. To learn more about our mission and resources for clinicians, visit afaxys.com. Don't forget to follow or subscribe so you never miss an episode, and we'll see you next time.